Sally with ItsSallyCares and going through some other thoughts that I wanted to share. Um, in particular, I want to give you a little bit of an example. I have a good friend whose mom was hospitalized, and she's in her late 80s with a real severe urinary tract infection, which, as you know, with elderly people, they're a problem and they need to be treated seriously because you can get septic and very ill from that. But so, anyway, she was in the hospital, got the hospital treatment, was too weak by the time they wanted her to leave. So she went to a rehab facility. It was kind of skilled nursing dash rehab facility. 2 weeks there, they decided that all of a sudden she was demonstrating reduction of oxygen capability, that she needed to be put on oxygen, supplemental oxygen, 2 liters, matter of fact. So it wasn't just a little bit. Then she wasn't making any progress, so she stabilized, plateaued, but she was nowhere near where she had been prior to all of these things, the urinary tract infection, and then subsequently going to rehab. She was not back to where she was. So anyway, she comes home, and she's home for 4 days, has to go back to the ER because her oxygen level's at 70. She was getting home health, but the nurse was able to discern that this is bad. Therapist said, got to go back to the ER. Went talked to their primary care physician, and the primary care physician couldn't even pull up the notes in their EMR system, the electronic medical record system, to figure out what was going on, which is another dandy thing about electronic medical records, the accuracy of which is not great sometimes. So you have to really be collecting notes on your own, keeping track of your own issues, making sure you're being the best advocate for those and for those you love. So in this case, she went back to the ER, had to be admitted. She now was having all these lung problems and whatnot. Nobody ordered a pulmonology consult. The hospitalist was good enough, apparently. Her breathing did not improve with conventional, here, let's throw this at it, let's throw that at it, nebulizer treatments, prednisone, that kind of thing. So then she gets discharged without too much of a plan. And this is the kind of thing you have to watch when you are in a hospital setting, because you now are faced with many young people who are in charge. And when I say that, I'm not degrading young people, don't get me wrong. But we have a group of medical professionals that only know electronic medical records. They don't know what a clinical chart even looks like or used to look like. Don't have a clue. They don't take the level of responsibility that they necessarily need to actually have the discussion with the physicians that you need to get more invested in this patient and what they need, because without it, we're never going to get to the bottom of this, and this patient's going to stay here. But oh no, she won't. She or he will get discharged and put wherever just to get them out of the hospital because it costs money to keep them there. Anyway, it's not pretty. And I'm sorry to say that it's really frustrating. Great nursing personalities, well-intended, But I told this nurse, who looked like she was in her mid-20s, you are the most important thing here. You have to listen to the family, make suggestions to the doctor, the hospitalist, who doesn't know the patient from anybody. So it's not like the good old days where the actual internist that was treating them came to the hospital to see him. We don't do that anymore. So the family has to be the main communicator about everything. The family has to be demanding of what's needed if they know what's needed. The family has to be involved, because if not, that old story, the squeaky wheel gets the grease. Well, guess what? Nobody's squeaking. I'm just like, wow. So now I'm helping these people as an outpatient sort of put these pieces together and figure it all out. So that's frustrating. And I just want you to know that you matter and that you need to be, and your family needs to be, advocates for themselves, for each other. Don't be afraid to ask for people that are specialists when a hospitalist isn't as invested. They've got a ton of people to see in the hospital and they can't. Do your homework. Pay attention. Don't expect people to just come up with answers for you. You got to get involved. Sorry to say. But in a way, it's a good thing because then you know, you know? You don't know till you know. Anyway, that's what I got to say about that. So we've got a lot of work to do on with this particular gal, and I'll keep you posted on that. But in any event, always be an advocate. Always have your questions ready. Always have them written down. Anyhow, have a great day. Like, share, and subscribe this video. Be your own advocate. Be the advocate for others in hospital settings, in doctor's offices, wherever, because it's not getting easier out there. It's just not getting easier out there. Take care. Bye-bye.